Today, the government's continuing to support our most vulnerable Māori and Pacific communities from the impact of the Omicron outbreak with a targeted investment of a further $140 million. Cabinet has agreed to a suite of 4 funding pathways to ensure that at-risk communities can put in place measures for Māori and Pacific whānau, individuals and households. Omicron is likely to disproportionately affect Māori and Pacific communities, and we don't want Māori or Pacific whānau falling through the cracks. To supplement the care in the community response to Covid-19, which Minister Sepuloni outlined last week, this investment aims to ensure that people are informed about those supports, can access them, and are provided continuity of care for whānau either side of self-isolation. This is to support faster recovery from Covid-19 for those whānau at risk of adverse impacts. There are 4 funding pathways. 1 provides $40 million of direct funding injections through the Ministry of Health to Māori and Pacific health providers to scale up the services they provide through care in the community. Another funds the whānau order commissioning agencies to enable wraparound and holistic support for whānau to ensure they have a plan for Omicron and get tested and know how to access care in the community support if needed. The third builds on the Māori community's COVID fund by providing direct funding through to regions, and it's administered by Te Puni Kōkiri in coordination with Te Arawhiti and extends existing contracts with providers where possible. There is also funding for Pacific Aotearoa Community Outreach Initiative led by the Ministry for Pacific Peoples to support Pacific communities, and some funding to continue the work connecting communities that is done through the Karawhiua campaign.
What this money does is to scale up everything that our Māori and Pacific providers are doing. I listed some numbers of where the infection rate is for Pacifica, the highest. I don't want people to think that then it only becomes a Pacific problem or a Māori problem. We saw the pattern last year in August, how quickly it moved from Pacifica right across the whole of this region. Because even though we're targeting our Pacifica, we also know we have these connections, whānau connections across Māoridom, whānau connections across Pākehā, across ethnic communities. So make no mistake, this isn't just about Pacifica or Māori, this is about all of New Zealand. And we are going to do our part in supporting Māori and Pacific providers, because that works and it will continue to work because those people are committed to the safety and well-being of all of our peoples.
We appreciate Māori health providers continue to be under extreme pressure to support their communities at this time. Funding and targeted investment for Māori health providers has supported them to scale up their capability and capacity to deliver their services. This support aims to help alleviate the pressure felt by providers. Pacific health providers are instrumental in delivering our Pacific response, ensuring Pacific communities are well equipped and prepared to prevent and manage transmission. The whānau order commissioning agencies have been key in supporting the well-being of whānau through the 2021 lockdowns and vaccination efforts. For example, in August 2021, 23 million was provided to the 3 whānau order commissioning agencies to support the delivery of essential services to whānau through the Delta support testing and vaccination uptake. They provided immediate support for more than 155,000 whānau, and the additional funding will draw on the role whānau order plays in communities as deeply connected and trusted providers. It will help whānau order to support people who need access to testing and care in the community. A further $40 million of funding is to be provided to Māori communities' COVID-19 fund, and this will continue to support communities to mobilise their own approaches and focus on supporting at-risk whānau to access health and welfare approaches. Funding decisions will be made through Te Arawhiti and Te Puni Kōkiri, working with regional leadership groups to identify areas of need in a streamlined manner. The MCCF is also intended to support rapid vaccine uptake and community-based planning and support for the Delta and Omicron outbreak. Marae, Hapu, Iwi and other Māori community organisations demonstrated their ability to quickly identify the needs of their community and immediately mobilise support. Using the arrangements in place for the MCCF to provide funding to support whānau and communities is an important tool to reach vulnerable Māori whānau who are not engaged with either whānau ora or health providers or care in the community. In addition, the Karawhiua campaign, a national unifying campaign informing Māori communities about COVID-19, launched by Te Puni Kōkiri and supported by the Ministry of Health and the Department of the Prime Minister and Cabinet, will receive close to $2 million of additional funding. The funding will ensure the continuation of the campaign to keep whānau informed about COVID-19. The Pacific Aotearoa Communities Outreach Initiative prioritises initiatives that are Pacific-led. Targeted approaches have worked well for Pacific communities, are scalable and can be stood up at pace. This investment provides innovative, holistic and Pacific-focused investment to enable Pacific peoples to prepare for, respond to and rebuild from the broader well-being and economic impacts of COVID-19. It will extend existing initiatives being led by the Ministry of Pacific Peoples to deliver interventions that address well-being issues caused by COVID-19. The funding will also ensure testing, vaccinations and public communications ensure a safe transition for Pacific whānau for the COVID-19 protection framework.
We've got to hold the line, stand strong. We know what the Prime Minister said yesterday, and Peony's just reinforced it now, that we expect Omicron to peak in the coming weeks. It'll then start to, there'll be a downturn in case numbers as we've seen overseas. But now is not the time for us to lose our nerve. There are a lot of people who have lost their nerve, and we see them and hear them down in Wellington in particular. We've just got to hold the line. And why do we have to hold our line? Because we're not talking about just the disease, we are talking about the lives of our people. And my great-grandmother in 1919 passed away from the flu that went around after World War I. So our whakapapa was broken then. You know, my father didn't get to meet his grandmother and sit on her knee and get growled by her and hear her stories. And, you know, we don't want that to happen. Now, if we had have just given up at the early stages, we would have a whole heap of mokopuna, our grandchildren not getting to see and know and hear their grandparents' stories and having the privilege of being growled by their nanas. So that's why we have to hold the line. I'm not going to go into all the details. Peony's outlined the pūtea, the $140 million that's come on top of all the other pūtea that's gone into fighting COVID. And, you know, we'll sift through the details in time to come, but this is really just a message to all of us that we still have work to do and we still have to stand strong for all our communities, because it is our Māori and our Pacific communities that will bear the brunt of this. Now, I hate to think about how much COVID is being spread around down in Wellington now, with people proudly not wearing masks, proudly singing, dancing, hugging, whatever they're doing together. When that protest disperses, all of those people will be going back to the four corners of this country, and then we will have more work to do. And this pūtea that we're announcing today is going to be there to actually fight what is going to be spread around the country in the coming weeks as that protest disperses, and also the natural spread of COVID as we're already seeing it. I think, though, that the dispersal of that protest is going to amplify the problems in all of our communities, from right up north where I live at the moment, Kaitaia, right down to Invercargill and every point in between. So thank you all for being here to hear this kaupapa, hear this announcement. We have, as a Māori caucus, our Pacific caucus, all of us been fighting for this pūtea to support the wonderful work that you are all doing. And we all have roles to play in this. Ours is to fight for the money and fight for, to get it dispersed, and then we hand it to you guys, the experts, who get it out and make, bear the fruit basically of that pūtea. So thank you once again all very much